Pascal, please tell us about health2o and your activities in Europe.
Well, health2con was founded in 2007 in the US, but we started having activities in 2010 with the first conference that happened in Paris. It was already called Health2.0 Europe. This event has moved twice since. We had it 2 years in Berlin, 2 years in London, and this is our second year in Barcelona. On top of activities, conference activities, we have some consulting that we do for major providers like the NHS in England, or we also work on some European projects. Like we just finished the GET project, which had the mission to support European digital health SMEs.
What are the key trends in the med startup market?
Well, I would say that we see a lot more startups, solutions that integrate some kind of artificial intelligence in them. I think that's a big trend. Virtual reality also is more and more used. Like we'll see at the conference an app where you can immerse yourself in a completely virtual reality to completely de-stress. It's a solution that is to manage your stress, and if you do it with a Samsung Gear and some headphones, it's a lot more effective, obviously. I think that's two big trends in terms of the technology. In terms of the movement itself, I think we're seeing a lot more reimbursements. So the insurance companies are getting a lot more involved. The conference where we've invited AXA, they're really the pioneer in reimbursing digital health solutions. And actually Germany is where they're making the most headways.
Tell us about this year's conference in Barcelona, please.
So it's a 3-day event. The first day we just had an investor event. We had about 45 investors that specialize in digital health. And then we had 10 people presenting their solutions in some kind of pitch competition. And we had about, I would say, 170 people in the audience. So that was good. The main conference will happen tomorrow and Thursday, and we have over 500 delegates for this event. I think it's the biggest number that we've had over the years. I mean, it's always growing, but we're happy that we're way over 500 delegates this year.
What are your plans for next year? What's the pathway for startup companies to become part of your show here?
So, yes, Health2.0 Europe is mainly a showcase of companies. We have 52 companies this year who are going to do a live demo of their technologies. And the way that they came onto the program is because they applied earlier on, about 6 months ago. Every year we receive about 150 applications, and we select between 40 and 60 companies to be part of the program. So the process, the review process, is mainly based on how innovative the solution is, the design for patient engagement or user engagement, and how it fits in the general story that we want to tell. For instance, this year, as we saw a trend in reimbursement, we wanted to create a session about that. So we invited AXA to be part of that session, and we recruited some of the companies for that session in the 160 applications. But they have a solution that is either built for the insurance company or a tool that an insurance company should or has already decided to reimburse.
Which city are we talking about, and what's the time of the year?
For next year's event, It's a little early to say. I must say that we like Barcelona. Um, it's it's a nice place to be. We very much enjoyed Berlin too, and we've had a serious offer to go back there, but I don't know.